And as Minister of Immigration, you obviously have been working a lot on repatriation of Canadians. And I want to know, how many Canadians do you approximate are still out there? If there's family members that have people that are trying to get back into the country, what is that process like?
Well, first, I just want to give a huge nod to both Canadians abroad who I know are anxious and who want to come home. And we're doing everything in our power to try and charter flights, provide them with consular service. My office has been working around the clock, Camilla, reaching out to Canadians abroad. And we are seeing a lot come home. There are still many more who we need to get back. And we're trying our utmost to get them home as quickly as possible. It is a time of anxiety, and I know that people here are worried about them, but I just want to assure your viewers we're doing everything that we can, and we're going to continue to work around the clock to bring Canadians home, and hopefully we'll be able to do just that.
And for people that are in the process of, let's say, getting their PR or their citizenship, is that still happening?
So we have a system in place right now where if you have been approved for a PR visa, which is to say you're abroad and you have gone through the entire process and you're ready to be established in Canada, then that visa is still valid. And obviously we want to respect the visa. I mean, the visa is an important travel document, and that's going to allow you to take those last steps towards coming to Canada. And in the long run, I also want to assure your viewers that this country was built on immigration, and it will continue to be a North Star, a fundamental value. We've seen ourselves through pandemics in the past. We've bounced back. And the way that we have bounced back is by being an open country and by recognizing that people can come from around the world and can contribute to Canada in great ways. I believe fundamentally that that will be the long-term trajectory, and I know that I am continuing to work in my capacity as minister to achieve that goal. In the short term, we are really focusing on repatriation. We're focusing on ensuring that people who are coming to Canada to contribute to food security, to contribute to the front lines of the healthcare sector, are able to do that to protect Canadians. That's the main purpose of all of these restrictions which are in place now around travel. And I just can't tell you, how important it is that we continue to focus on those efforts right now.
Marco, so one of the last updates we've heard from Prime Minister Trudeau is that Canadians should expect things to go back to normal in 12 to 18 months, which I think surprised a lot of people that were expecting this to be a quick 2-week, 1-month fix. So what can you explain to those Canadians that are wondering, is it actually going to take a year for life to go back to what it was before?
Well, yeah, I think that's a really good question. And we're all still adjusting to this new normal where we're staying at home a lot more. We're isolating from our families and our friends. And especially at this time of year, we're trying to find new ways to stay connected through social media platforms. And I've got 2 young kids, and they're, chomping at the bit to get outside. As the days get longer, the season's turning, there's a real temptation to want to ease up. And I think the message that has been delivered by the Prime Minister, by our chief medical officers, and really all levels of government is, don't do that. Stay at home. Continue to show that discipline in isolation, and keep your distances for the time being, because that's the only way we're going to continue to flatten the curve. And that is really the objective here. It's to keep the number of cases to a minimum, to prevent future outbreaks. And when we're on the other side of the curve, and we have a vaccination, that's when there can start to be a conversation about, lifting some of these restrictions, but not before then. And so that message is really, really important.
This past week, there's been a lot of talk about the CERB. The applications finally opened up. Is there an update on how many Canadians have actually applied and how many are expected to apply?
Well, this is actually a really good piece of news. We've already received and approved over 5 million CERB applications. So what that means is that 5 million people who lost their job because of COVID are now getting money in their pockets as quickly as possible. So if you apply online and you opt for direct deposit, you're going to get about $2,000 a month, up to 4 months, within 3 to 5 days. So that's a very quick turnaround. And the other thing that we're doing, Camilla, is we've introduced a wage subsidy, which is going to help small businesses and really businesses right across the economy keep that relationship open with their employees. So we're trying to stop people from being laid off in the first place. And I don't know if you saw, but recently WestJet and Canada both hired back literally thousands of workers that they had initially laid off because of the wage subsidy, which will cover up to 75% of their salaries. So this is a really good piece of news. Two really important programs which are designed to get financial aid and support into the pockets of Canadians as quickly as possible. And one last thing I'll mention is that on procurement, we are buying as many masks, like literally millions of masks, gowns, and test kits as possible. We're buying them on the global market, but we're also taking a made in Canada approach. So we're accelerating domestic production of personal protection equipment, and that's going straight into the front lines in the hospitals to the doctors and the nurses who are doing such great work. And I just want to thank them for the way that they're literally saving lives every day. But they're also, that equipment's going to go into long-term care facilities, like for instance at Villa Colomba in my riding, where there are many, many retired people who are being looked after by nurses and caregivers, and they're going to get the benefit of that personal protection equipment procurement effort as well. So lots of good things that are going on, and we're going to continue to respond as effectively and as quickly as we possibly can.
And has there been any talk about what happens after those 4 months? Because we have heard some news that, we don't expect things to go back to normal for at least a year. So after those 4 months, the people that are still entering a rocky job market, the students that can't find their part-time or seasonal summer work to afford their education, is there anything in talks about what happens beyond that date where they have received their full 4 months?
Well, so we're obviously keeping all options on the table, but you mentioned summer and summer jobs. I'll also say that for students, we've expanded the eligibility for Canada's summer jobs, and that's good because if for whatever reason your school isn't fully opened over the course of the summer or in the fall, then you're going to be eligible to receive up to 100% of your salary for whatever summer organization that you might have applied to work at to save up for tuition, to save up for room and board while you're studying. And beyond that, as I said, we're going to continue to explore whatever solutions are required at that time. But I remain very optimistic that if we continue to follow the best medical advice that's out there, so staying at home, washing your hands, keeping that physical distance, that we will eventually flatten the curve. But it's important to keep that discipline right now. As the Prime Minister has said many times, and our best medical experts, don't let up now. I know it's tempting because of the summer and the spring, which are coming, but we really have to continue to show discipline around those three golden rules.
And you mentioned PPEs, you mentioned ordering more tests as well. What is the testing process like? Because there have been a lot of comments about the online self-assessment tool and just the availability of tests. So if someone at home thinks that they have the symptoms or they have a family member who might be infected, what is that process actually looking like as of today?
Well, one really good piece of news I saw earlier just a few days ago is that Ontario's announced that they're going to be nearly doubling the number of tests that they're going to be administering every day. So what this will do is it will increase the number of people who are being tested, which will help us identify potential vulnerable populations and vulnerable locations in the province of Ontario, which is being done right across the country. So we want to leverage testing as a means of learning more about the virus, but also preventing outbreaks and protecting vulnerable groups. The more that we can do it, the better. And that's why I think that the news around Ontario increasing the number of tests that it's administering every day is really, really important news. But it's just one of many things that we're doing to help flatten the curve. So there's testing, there's the exploration of potentially using contact tracing with the use of your phone and your apps. And then there is the exploration of a vaccine. And the work around serology is very interesting. It is just at the very beginning, but the more that we can learn about this virus, how it spreads, what are the incubation periods, what is our ability to develop an immunity to it, the more we will be able to strategize in the future. And the one thing that I think that has become clear about COVID-19 is that it is a very insidious and contagious virus. So we've really got to make sure that we're following those rules around social and physical distancing, but continue to invest in some of the research that I just described and the new technologies, which will help us flatten the curve and also prevent outbreaks in the future.
Sorry, just to circle back, what is the contact and trace through our phones that you were mentioning? How would that work?
So it's not an idea that we've seen in Canada yet, but if you take a look at some other jurisdictions, they are starting to use technology on phones, which would allow us to sort of learn more about people and where they are and who you may have come into contact with, while of course at the same time balancing privacy concerns. So we're very much on the front end of this discussion in Canada, but there are other jurisdictions who have looked at using technology on mobile devices to try and pinpoint where it is that that the virus may be spreading through contact, either physical contact or through contact with surfaces and locations. And then that data will help us again really hammer down the potential outbreaks in locations based on the data that we are collecting. But again, just to emphasize, we're not there yet in Canada, and that's an ongoing discussion.
Okay, and then would that be, you think, potentially something that people would be able to opt in or opt out, or should there be concern for privacy when it comes to the information that you have on your phone and the information that the government can actually receive?
For sure, and I think, even as we face a crisis, we want to make sure that we're protecting people's privacy, and there are discussions around how we would use such an initiative. But I just want to assure your viewers that we would absolutely be sure that we're striking that balance and use it to the best of our efforts to protect people.
And what message would you have for Canadians right now that obviously they're uncertain? We want to be out, like you said, enjoying summer, enjoying the weeks that are to come. What would you say is the best strategy to help flatten the curve? Because at the beginning, there was talk that maybe masks didn't work. Now, should we be using masks? Should we be continuing to wash our hands? What are the key things that you really recommend that Canadians should focus on right now?
Well, just on masks, I know that our medical advice has been that it can be protective, especially if somebody has symptoms, and putting a mask on will protect the people around them. So it is important to stay in touch with the latest medical advice. But the real golden rules are: 1, stay at home; 2, continue to practice physical and social distancing. So, keep that space around 2 meters between as many people as possible. And 3, wash your hands. And they're not complicated. And if we follow those basic rules, we are going to continue to hammer down that curve. And that's really the key advice that I want to continue to offer your viewers. And as I said earlier, I know it's challenging, especially right now. We'd be used to having big dinners and going to a place of worship, whether it's church or a synagogue or a mosque. And I know that that's hard. I know it's not easy to adapt and to come up with new ways to stay connected. But that's why we have important social media platforms like the one that we're using right now, whether it's Skype or whether it's Zoom or whether it's Facebook or whether it's Google Hangout. There are so many options that we can use to stay in touch. So I'm just encouraging all of your viewers to stay optimistic, to stay hopeful, and to stay in touch using these great technological innovations, which are at our fingertips now. And it's great to do it. We're doing it with my parents and my in-laws, and I don't know if you're doing it with your family, Camilla, but hopefully it's helping us all stay in touch at this really special time of year.
Absolutely. I think what helps about being in Canada is that a lot of us have family in other countries regardless. So this is just something that we're used to with communicating. Now you just have to do it with the people that live across the street too.
That's so true. Exactly. And I think if they follow your advice, which is consistent with the best medical advice that we've got out there, we're going to flatten the curve and we're going to get over this. We're a great country. We're made up of just the best people. And I am hopeful. I know it's a challenging time, but I remain very hopeful and optimistic about the future for Canada. I just, want to wish you the very best.
Thank you so much, Marco, for joining us and for those incredible words for our viewers as well. And keep fighting on. We're going to get through this.
Grazie. Thank you very much, Camilla. Take care.